29th, 2020, someone at the meeting I was attending suggested our annual conference might need to be canceled. She worked in the airline industry, and I thought she was being dramatic. While the world would change less than 2 weeks later, on March 2nd, I didn't yet feel it. COVID-19 was still thousands of kilometers away. We left Toronto for Philadelphia on March 3rd. Aside from the giant jugs of hand sanitizer in the hotel lobby, everything was normal. Museums and bars were open. We watched the Flyers play against the Colorado Avalanche, my first live NHL game. Like thousands of other Quebecers, we flew home on planes that very well could have COVID-19 cases in the cabin, a threat from the United States that was barely evident by the time we returned on March 7th. That next week, school was only in session 3 of 5 days. There was a PD day, a snow day, and then nothing. School was canceled. My partner, who was on sabbatical at Penn State, rented a car and drove north through western New York State just as the border was closing, hands clutching the steering wheel through a barrier of disinfecting wipes as he listened to American talk radio insist that COVID-19 was just a hoax. In the space of a year since that day he fled, of the 2.6 million residents of western New York, more than 2,200 died from COVID-19 and more than 1,500 people caught it. Endnote 1. We all have our own memories about where we were at the start of the pandemic. March 2020 will be tucked away forever in our minds as a time where everything ground to a halt and our dreams and plans for the foreseeable future turned into dust. If I close my eyes, I can still see the May I was supposed to have, the concerts in July, the 4 weddings, the fun. But that's not how life works in a pandemic. It becomes 100% oriented towards surviving, trying to rebuild a life based on our new circumstances. I was transformed into a stay-at-home mom with the rhythm of a day that moves slowly and very quickly at once, arriving at the end with the singular thought, I hope I didn't get COVID-19 today. Wake up the next morning, do it all again for as long as it takes. Regardless of where on earth one found themselves, whether aboard a container ship, working in a hospital, mine, or factory, fleeing war, famine, or injustice, or in quote-unquote lockdown, whatever the local version of lockdown meant, the pandemic was a giant shock to every system. It stretched social safety nets thin, left a trail of millions dead, and very few unscathed communities around the globe. The United Kingdom and the United States were countries where leaders boasted about how ready and capable each were to handle a pandemic. But they were led by bumbling elitist men, both of whom were infected with COVID-19 and whose individualistic, strongman approaches to leadership collided with the reality that the pandemic needed a collective approach. Despite the fact that each country had healthcare systems premised on very different models, one that is primarily public versus one that is primarily private, the outcomes were both alarming. By June 30th, 2021, in the UK, there were 4,830,418 total infections, 7,247 infections per 100,000 people, and 128,162 deaths, 192.29 deaths per 100,000 people, and note 2, versus 33,343,961 total infections, 10,159 infections per 100,000 people, and note 3, and 604,656 total deaths in the United States, or 184.2 deaths per 100,000 people, and note 4. By comparison, Canada's infection rate and death rate was 3,767 per 100,000 people and 70 deaths per 100,000 people. At note 5. Canada often contrasts itself to the US and the UK, and based on these figures alone, Canada fared better. Except even saying this depends on how the numbers are spun. Canada's case fatality ratio as of July 1st, 2021 was 1.9% higher than the US's rate of 1.8%. Canada may have been better able to control the spread of the virus, but when people were infected, from February 2020 until July 1st, 2021, the number of people who died as a result of their COVID-19 infection was slightly higher.